Well, a startling 781 new positive COVID cases have been reported by the Ministry of Health. In its daily update on Wednesday, the ministry said those results were from samples taken between November 12th and November 16th. The total number of active positive cases is 7,689, and 6 additional COVID-related deaths have been recorded by the Ministry of Health. The persons were 5 men and 1 woman. Their deaths take the COVID-related death toll to 1,891. And as the rollout of safe zones continue, the presentation of the proof of vaccination appears to be posing some issues. Despite the health regulations governing this process, which allow for a copy of the vaccination cards as proof to be given, there are concerns this is not being allowed in certain safe zones. Addressing the matter on Wednesday during the Ministry of Health's COVID-19 update, Health Minister Terence Dayal Singh said they are working to change this.
So again, through the Chief Medical Officer and the Interministerial Committee, where DCP Williams is a member, we have indicated to the TTPS that we will accept phone shots or digital records as proof of vaccination. So it is something I asked the CMO to remind his counterpart at the TTPS very often, so it can be drilled down to all the divisions.
Meanwhile, people with diabetes are being urged to get the COVID-19 vaccine, and in this month dedicated to raising awareness about the lifestyle disease, General Manager Primary Healthcare Dr. Abdul Hamid says the 13% of diabetics in Trinidad and Tobago should consider getting this layer of protection.
Does diabetes put you more at risk of COVID-19 infection? So at the moment, there is not enough data to suggest that it does cause COVID-19 or put you at risk, but we do know for a fact that the risk of severe infection is more when you have diabetes.
The doctor says with the amount of diabetics entering the system, some of whom are not aware they have the disease, it is now routine to test for diabetes.
But we do know that COVID-19 can cause insulin resistance and is now reported to affect the pancreas itself that produces insulin. Certain medication that we use for COVID-19 infections includes steroids, and this can also cause high blood glucose levels.
The doctor says vaccines are safe and effective for those who have diabetes. However, he warns that the diabetic will have to monitor their glucose levels for 48 hours after receiving the vaccine, as these levels may be abnormally high in that period.